We're here at the brilliant Hilton Hotel in Croydon, and we're here to launch the primary care network engagement with the practices, and it's a really exciting day. The aims of today's event is to ensure that the primary care clinical directors, of which there are 10 of them, are engaging with their local practices to shape the primary care network agenda as we move forward. And it's a really important thing to get right.
I think this event is going to generate the right level of excitement about caring for people, not just patients, but caring for people to stay healthy rather than caring for them after they get sick. By working in an integrated way, all the different agencies, we very much want to turn from a sickness service into a health service. How do we keep the population of Sutton as healthy and mobile and independent and living in their own homes as long as possible? Because we know that's what people want.
Primary care networks were kind of only introduced April to June time. However, everyone's quite excited by the buzz around it because the theory behind it is fantastic. It's actually about common sense, really, getting GP practices linking in with all our community as well as some of our other sectors that actually help us, so our nursing staff. So rather than sending off to hospital all the time, we can manage everything within a community, and what a lovely way to do that.
We're in our very early stages, but I suppose the first way in which we're working together, there are what has been called additional roles, so other healthcare professionals that will be able to come into the networks to help do different tasks. So for instance, we are as a network employing clinical pharmacists, and those pharmacists will work across every practice within the network.
Primary care networks are the future. It's how we're going to deliver lots more care close to where people's homes are in their communities, and I'm really hopeful that the clinicians who work in my hospital will be able to come out of the hospital and work with GPs in the primary care networks to keep more people healthy.
Going forward, we're going to be bringing paramedics into our practices, physiotherapists into our practices. So it come to a point where someone has a muscular problem, they want to see a physio. Again, they'll be sitting in your practice maybe one day a week. So it's just about having an idea, because we've been almost running a year, no one knows about it, and no one's really made big efforts to make a launch. But our organiser, Shazma Mawani, my colleague, she's done this fantastic event, and we want to make sure everyone knows what social prescribing is and what primary care networks is by the end of the day.
In Sutton we have a really strong history of collaboration and working together, so I'm really proud that we've actually got this far. We've all come together and we're all working towards the same goal, to improve quality of health and social care for our patients in our borough.
So trying to address loneliness and social isolation is something that GP practices don't traditionally do, but we're trying to reach out and develop new ways of addressing these concerns that turn into health problems for older people through social prescribing.
It's a different way of working. We've known for many years that actually the NHS, we are struggling to see some of our patients, and we're trying to find different ways of thinking about patients in the bigger picture, not just medically related, not just giving medicines, but actually trying health things, so advice, what we eat, what we do, how we mix with community. It's a very, very new concept. Not everyone knows about it. And actually, if you tell a patient, oh, go and see this person and have a chat, when they think they've got a medical problem, may be quite tricky. So the hope is, by telling you all about today and telling you about social prescribing, people will hopefully buy in and be inspired, but also hopefully, in an ideal world, reduce some of our GP consultations so we can do a lot more with some of our cancer patients, our diabetic patients and our blood pressure patients.
I plan to make sure that all my staff have the knowledge about social prescribers particularly, because I think that's the way forward. And we have lots of patients who come in just for that sort of chat. They come in and see the receptionist for that sort of chat. They're lonely, and I think social prescribers are going to be the way forward, and I want all our staff to be able to recognise what they do and what benefit they're going to have for the practice.
It's a huge learning curve for me to actually go out there and see and find all these resources that we're going to be able to utilise.
So the conversation today is really important because it allows everyone to take part in it, not just the leaders. If it's not a grassroots development, ultimately I don't think it'll be as successful as it could be, and if it's not as successful as it could be, then it won't be so good for the patients in Sutton.
We all have our own practices and we all know each other, and I think by working together we will see areas where we can improve patient care.
We know that we can't really fix health without fixing well-being, so it's looking at all the other non-clinical factors that affect quality of life of our patients. And actually, as GPs, we need a varied workforce in our practices to help us manage all of these issues adequately. our social prescribing launch is that we have a very special message of support for the whole of general practice in Sutton from the Mayor of London.
I wanted to send a message of support for the important work Sutton Primary Care Network are doing. As you know better than anyone, enhancing the health and well-being of Londoners is about so much more than traditional health and care services. I therefore want to congratulate you for the pioneering work you're doing to enable your residents to get the non-clinical support they need to thrive. And as Mayor, I want to pay tribute to all the wonderful NHS doctors, nurses, health professionals, receptionists, administrators and others in the room today for making such an incredible contribution to London. On behalf of our city, thank you for the real and positive difference you make to Londoners' lives.